Thanks so much, Mr. Chairman. You know, most of us have a loved one, or we at least know someone whose loved one has experienced the difficulties of Alzheimer's. In Utah, there are more than 300,000 people aged 65 and older, and as many as 1 in 10 of them have Alzheimer's disease, a higher rate than most other states. The number of Utahns with Alzheimer's who are 65 and older is expected to increase by as much as 40% over the next 5 years. Thankfully, Utah's taking proactive steps to address Alzheimer's disease and related dementias. Dr. Supiano, can you tell me about some of the ways in which Utah's leading the country in Alzheimer's research and treatment, and tell us a little bit about how Utah's state plan for Alzheimer's disease and related dementia is contributing to this effort?
Yes, thank you, Senator Lee. And as you've pointed out, Utah does have a very high rate of Alzheimer's disease in our state. It is a byproduct of the good longevity that we have. So the strongest risk factor for Alzheimer's disease and related dementias is advancing age. So with the great life expectancy in our state, we can expect to have more cases of Alzheimer's disease as time goes on, all the more reason to focus on these preventative strategies as I was just discussing. So you're correct that we are very fortunate that our state legislature has supported the implementation of the Utah State Plan for Alzheimer's disease and related dementias. There is now, I believe, $1 million as a line item coming every year to the Department of Health to implement this strategy. It calls, for example, for enhancing screening for cognitive impairment across the state, so a dementia-aware state. It calls for some of the workforce needs that we've been discussing this morning. It calls for a further investment in Alzheimer's research, and it also calls for supporting community organizations, as we heard from Mrs. Lehmeyer in South Carolina, working hand in hand with community organizations and AAAs is another part of the state plan. So with that, and also with the support that we have through the Utah Governor's Commission on Aging, we're really poised to advance these programs that address Alzheimer's disease and related dementias across the state. The final aspect of this that I'm really excited about and relevant to today's hearing is the focus on caregiving. So as part of the Center on Aging that I direct at the University of Utah, we've made an investment, and thanks to funding from the National Institute on Aging, to our College of Nursing, and to Dr. Lee Ellington, we have support for a caregiving coalition that will focus on supporting the research and implementation we need to help better support family caregivers, particularly those with dementia. So we're really well poised in Utah, Senator Lee, to with the support that we have from the state legislature, the Department of Health, and with the research support from the University of Utah, and the support that we have from NIH, that we are poised to make these advances.
Thank you so much, Dr. Supiano. Mrs. Lehmeyer, in your testimony, you speak about the personal experiences and sacrifices that you made in caring for both your mother and your father, and how that led you to found ARC of South Carolina. My own mother-in-law, Carol Burr, passed away just about a year ago after a long and heroic battle with Alzheimer's disease. So I know firsthand some of the difficulties this disease brings both to the patient and to the loved ones of a patient. The services that you and your colleagues provide really exemplify the value of everyday individuals stepping up to serve those in need. And as you put in your testimony, the nonprofits are essential to the community, and I couldn't agree more. So, Mrs. Lehmeyer, given your experience at the ARC of South Carolina, what can individuals across the country do to better serve and provide relief to those in their communities who are struggling with Alzheimer's, dementia, or the possibility of being a better caregiver?
Well, thank you, Senator Lee, for that question. As you say, nonprofits are essential because we can provide so many services much more economical and affordable for families because we are nonprofit. We rely on donations and grants and state funding coming down from the Area Agency on Aging and the South Carolina Aging. I would just encourage families to reach out to, as I did with our church, or reach out to an organization and ask for if they can help build a program similar to the ARC. You know, for 25 plus years, I have spoken to a lot of states and communities across the nation at different conferences and things that I've been to and attended as a presenter. And there is a network of respite care centers across the nation funded through Brookdale National Group Respite Foundation. And I would encourage communities to reach out and to that organization and find out about starting a respite center or other type of caregiver services. Talking, getting together with support groups and things like that, and then just building from there, because there is going to be someone in that community that will be a leader and will step up to the plate. But the support needs to be there to help them do that. And I have found that the Chamber of Commerce and some of our other healthcare partners that provide care and support to families are more than willing to join the cause. I hope that answered your question.
Yeah,
Thank you
very much so.
question.
Thank you very much. And thank you, Mr. Chairman. I see my time's expired.